Good afternoon, everyone. Good afternoon, IHMR. I am really happy. I think I have the attention span of the maximum people. People are back from the refreshments. So, before I begin my session, I would want people to make a conscious announcement to me, probably by raising hands, if we did a few mistakes in the past 1 year. How about maybe between 5 to 6? So, I see a lot of hands raised up. Great. I feel nice. How about we made somewhere close to 3 mistakes or 2 mistakes in the past 1 year? Yes. Thank you so much, sir. I feel humbled. I probably will fit in the first bracket though. How about somebody who's not made a mistake? Somebody who probably did not even do this, scribbled and wrote again? So I'm not visualizing a perfectionist sitting over here. And that's what my talk will take everybody around over here in the later part. What I want all of us to understand is I have spent close to, she said 15, it's 18, more than 18 years in healthcare facilities these days. And I have witnessed that we have a challenge that we want to bring in the best of clinical excellence into this country, into this state, into this city, into the hospital. But then there is a lot of impact that the patients these days, or maybe not the patients, just the attendants or the viewers sitting right in front of me, have a misfaith in our healthcare systems. And that is something that I want everybody to probably take back as a message. I'm sure majority might disagree. If I could just convert the mind of few of you to ponder over, that would be something that I'll take away for myself also. So, what if, did any one of us have experience of moving into a healthcare facility, if anybody did as patients or even as attendants, and you would relate? So, majority of us, sir, definitely sitting over here, does majority of us work in the hospital. So, imagine one fine day when you wake up post your surgery, you are told by your attending consultant that there was a error, there was a complication which happened with your surgery. How would that, as a person, that you would take? The first thought that probably comes into the mind, something that I'm actually visualizing every day, something that I'm going to resonate. I want a refund. I'm not going to pay for this. I did not come here for this. I came here with the guarantee that this doctor took me in. Do you really think a doctor can guarantee a treatment? How many of us would agree to that? We all walk up to a healthcare facility with a calculated risks. And that risk is something that we probably sign up as a consent or agree to a doctor. Doctor would be telling you sitting right in front of you, ye ho sakta hai, ye ho sakta hai, ye nahi ho sakta. But then you are there skeptical in your mind and you're there with one vision, I will go back healthy, I will go back fine. But that one thought that needs to be there in your mind when you walk up to a doctor or when you go back for a treatment is that there is a risk involved, and that risk could be us. That could be because of a complication, could be because of a mistake that happened. And why that mistake would happen is something we will talk about. Thousands of patients every year in our country, they undergo a lot of medical errors, and a lot of complications happens. But then, because we are not receptive to this is something that plays around not just in the mind of the patients, not just in the mind of the doctors, it is there in our society. These are not just statistics that I'm talking about. These are statistics which will revolve around your life. You will probably try and shove it aside. We would not talk around it. We would be very happy to close our eyes. We don't want an environment where we encourage that learning, encourage the learnings that we could, envisage from accepting a mistake. That is something that in case if we do, we will probably make it a little bit more easier, a little bit more comfortable zone for doctors like me, doctors like sir, to probably bring in a lot more healthcare facilities developed in this country. So I'll share with you one of the stories of one of my colleagues during the earlier days in the medical field. There was a complication. There was an error that was made during the surgery that led a big devastation in the family of the relatives. And they had this notion around just blaming the doctor, blaming the healthcare facility. And they could never come up to probably have a good thought process around the doctor. They took a million second opinions also around the same. But imagine what happened with the doctor himself. That doctor felt devastated because he had a very humble profession which demanded perfection. That doctor could not perform well for years together. That doctor did not strive. The fellow colleagues also did not take it very nicely. We couldn't discuss openly also in the hospital around what this mistake actually could have brought in. It could have brought in some improvements. It could have brought in something which would do better for the next patient. So we want to develop that kind of facility. Why I'm talking to everybody over here is, in case if we are able to accept that one mistake of a doctor, it would bring about a whole lot of change. I am not saying that we accept those complications. It is life we are dealing with. Whomsoever that I would resonate this topic to would say, you are talking about my life. Yes, it could be mine too if I go to a healthcare facility. So if I can accept it, it would be great that we all accept it. So past in the 19th century, you would see that the number one killer in the world was doctors not washing their hands. Is it not a mistake? Is it not an error? We've traveled a fair bit of path. We've traveled great. The hospitals has made the hospital very secure. We do not have these errors now. We are checking all our steps. When I say this, many people will agree because they are into policy making decisions. They are into making those SOPs for the hospitals. We're checking every step of ours. But then still there is a component which can arise, which is a mistake. So we have to acknowledge that this mistake was probably, if I say that in a lifespan for a doctor, they would make average of 2 to 3 mistakes in a year. How would that bring up to your face? You would probably say, I'm never going to a hospital again. Would you not? But that's a hard fact. We will all encounter it, whether we see it or whether we just want to argue, why did it happen? Those are two things that you will have to understand and relate to. These are facts that I'm talking about, that a doctor will make 2 to 3 mistakes in a year. Those mistakes could be because of a complication. Your anatomy is not same for me and for anybody else. Could be because the doctor did not approach the same way that it would approach for the other patient. My most important question for today's talk, and I hear that a very lot many people's, whether it is your own staff, whether it is, I'm sure all the students studying over here, what would your answer be, a yes or a no, that are doctors God? If I can hear that. People don't want to say yes and no after my talk. I'm happy. But the majority that I've heard till now is yes, we say a yes to this answer. Why do we say yes to this answer? Is because you've got a great expectations from that doctor. You have got a great respect to that doctor. But trust me, that great respect and that perception that we have to the doctor will not make him a god, will not make him omnipotent, and will not make him go into an omniscience. The doctor cannot do everything right. The doctor cannot think everything right. So I'm sorry, I'll break the notion today that doctors cannot be gods. Why they cannot be gods for us, and they could be a million reasoning. I've just brought up 2 3 important ones for us to understand. That there is a lot of skill management that a doctor undergoes. We probably before a neurosurgery, sir would have spent close to 13 years, sir, studying right from his MBBS. Imagine 13 years a doctor is studying before he can actually call yourself, yes, I can see a patient and deliver. The travel for other departments, IIT and all, little easier. I don't know the number of years, sir, but I would still say doctors spend a huge number of years studying, upscaling their skills. But then you will still definitely be treating a patient, curing a patient, giving a medicine to a patient, which he or she might think it's a miracle, but then it is eventually something which will not be consistent. It can have some other flaw because you are just relating it to that of your studies, of your learnings. It is not something which is tic tac 1 to 10. So there could be an error which you can encounter there. Now, a lot of doctors would want to look at a mirror every day in the morning and would want to see somebody who is a perfectionist. But then this does not happen, what we see over here. A human will always remain a human, and we want that human system. And I will tell you why we will want that human system. This human system will make errors in the way. We will not do those defined steps in the same fashion as a robot will do, in the same defined manner as a robot will do. What do you expect the outcome to be? Would you expect it to be the same for everybody? It could be different. And that is something that we will not need to accept. That there's a human who's treating us. It's not just a robot who's helping us reach, get rid of our disease or the condition we have come to them for. There are a lot of ethics which revolve around in the healthcare. You will all go into the students over here, and I'm sure all the dignitaries would have revolved that you have your ethics around your acts, as the government policies are there, PCPNDT rules are there, and doctors' treatments get defined by then. Doctors go into a lot of ethical consideration when they're doing their treatments, and these could at times not relate to the way that you wanted your outcome to be. And that probably will bring into your mind that I went in for something else, but I'm now coming out for something else. So these ethical considerations, whether it is Indian healthcare system or whether it is a Western healthcare system, will always be there. We are defined by certain legal guidelines. We are bounded by certain communications that we receive, that how the healthcare should revolve around. And that will probably, maybe not on a frequent basis, but one or the other situations we could encounter an error because of that. The technology these days. So I would show another picture of us. How many of us would feel very comfortable with the AI around us, the complete AI? The AI is bringing a revolution. But for me, I would still rate going to a doctor for a treatment than going to a robot. Going to a doctor for my scan, for my CT scan and an MRI scan. And very well these days, let me tell you, the GEs of the world, the Philips, they are doing a fantastic job in getting you those images read, in giving you a pre-printed report. This and this is what has happened to you, sir. But would you be comfortable to go up to a doctor who looks like this? Or would you want somebody like the many of us sitting over here? So we will always have the human factor with us. We will not be comfortable if a robot is operating. There are robotic surgeries. Us in the hospital, we do robotic surgeries. We have launched it first time in Rajasthan. But there is a surgeon who's sitting behind that robot, let me tell you. It is not just a robot. You will not be comfortable. None of you will like it. Even if they tell you that that robot, Da Vinci system, quotes it that they are 99.9% error free, and humans would not be that, but you will still choose to go to that human. If you choose to go to that human, my dear friends, my only request is that accept the humanity in that doctor. I am still not done. I just want the doctor's heart to come out to this forum today. The doctors want to talk about their mistake. They want a very healthy environment. They want an environment in which we will be learning. They want an environment in which we will talk about improvements. We will talk about learnings. We will talk about what went wrong and what we could do next. Give them that space. And why we give them that space? If all of us relate to this picture, do you see the face of this person? Would you recognize? I wouldn't. Maybe it could be me. I don't know. It could be any one of us sitting over here. When we did not know the face of this person, when we did not know the name of this doctor, we trusted our lives for it. The world trusted. But let me tell you, I was behind. I was behind seeing the entire face. We had the most, I would say, the most vulnerable 1 month when the COVID second wave hit all of us. And I would not go back to my home for maybe, let's say, 10 days or 20 days because you would have to live inside the hospital. There was a taboo around COVID. And you actually saw this very doctor who was there helping, nurturing the. We did not know what this disease looked like. We were just there at it. When the world trusted this doctor, and in spite of the 100 mistakes we made, in spite of just hitting with the trials, hitting with some treatments, innovating, discussing on the phone, this could go right. There was a patient who would die. There was a patient who would not die. We actually were looked upon as gods at that time, but with all the mistakes. So I would still request that in today's world, let us start thinking about how we came over those eras. Let us start thinking about that very doctor is sitting right in front of us and trying to treat us across. So, my dear friends, my only thing that I want everybody to take from this talk over here would be that doctors cannot be regarded as gods. We're all still very human. We all still want the perception to be thoughtful around us that we could go wrong. We could make our own mistakes. Acceptance is something that we are looking forward to. We want our perception to change to this acceptance. And here I am Dr. Suhasani. and I make mistakes, and I'm definitely evolving, and we will come back stronger in front of everybody else. Thank you so much.